Once you have come to our clinic to begin human growth hormone replacement therapy, we will immediately start a holistic approach to attacking the ravages of aging and maintaining your good health. Our program is not limited to growth hormone, HGH replacement therapy. Part of your treatment includes the latest research and methods of treating the vast array of potential health problems that you may be suffering from, as well as preventing future problems. This includes pharmaceutical drugs such as statins, the most commonly prescribed cholesterol-fighting medicines. While there are many medical issues that are a source of disagreement among scientists, physicians, and researchers, there is one topic that virtually everyone is in agreement. High levels of low-density lipoproteins, LDL, cholesterol, is a severe and potentially deadly risk to both your health and your life. Elevated LDL cholesterol levels increase your risk for cardiovascular disease. This is due to LDL cholesterol from your blood barging into your arteries at ever-increasing amounts. When this happens, LDL is oxidized, which sets off a chain of events that eventually results in the formation and accumulation of atherosclerotic plaque, leading to a condition called atherosclerosis. Atherosclerosis is a hardening of the arteries due to a buildup of plaque on the inner walls and often leads to heart attacks and strokes. The causes of this condition are the usual suspects in many other health problems: poor nutritional habits, too much junk food, processed food, and sugar, genetics, sluggish thyroid, obesity and large waist circumference, diabetes, smoking, and lack of exercise, i.e., being a couch potato. Statins have become a popular choice to treat cholesterol problems, and for many, they are efficient and often well tolerated. Statins are one of the most frequently prescribed classes of drugs, and more than 25% of adults age 45 and older take statins. Statins have been used primarily to treat high cholesterol. Statin drugs like atorvastatin, pravastatin, and simvastatin work by inhibiting a liver enzyme that is involved in the production of cholesterol. They are most effective at lowering levels of LDL cholesterol and may also contribute to increasing levels of high-density lipoprotein, HDL, the good cholesterol. In the most recent analysis of statins for primary prevention in patients who have not had a previous cardiovascular event, a 14% reduction in all-cause mortality and a 25% reduction in fatal plus non-fatal cardiovascular events was reported. However, the validity of these numbers has been questioned. Some researchers have claimed that studies conducted by scientists without conflicts of interest did not find any reduction in cardiovascular events, in contrast to studies paid for by pharmaceutical companies. Like most medications, statins have both good and bad sides. In many cases, the benefits outweigh the risks. Here is more information about statins that will make you think beyond your cholesterol number. Cholesterol is the single greatest risk factor for heart disease and a major risk factor for stroke and disease of the arteries. Statins reduce harmful cholesterol by slowing its production in the liver. You may think of cholesterol as just a number, but using statins has other benefits to your cardiovascular system. Research has shown that statins may reduce the incidence of heart attack, stroke, and death in people without heart disease. In fact, statins have a primary role in cardiovascular disease prevention. They've proven to reduce heart attack and stroke by lowering harmful cholesterol, which thickens arteries and increases the risk of clots. A review of 90,000 statin users by the Medical Research Council in Oxford and the University of Sydney concluded that risk of fatal heart attack or stroke fell by about a third. Benefits started immediately, increased the longer statins were taken, and cholesterol continued to fall. The study reported statins are especially valuable to people at high risk of heart attack or stroke and also protect patients whose cholesterol was considered normal. Additionally, statins have a few side effects that appear to be helpful, such as improving endothelial function, the balance between vasodilating and vasoconstricting substances produced by or acting on the endothelium, which controls platelet adhesion, coagulation, and immune function, and reducing inflammatory markers. Other studies have reached the same conclusion. Statins save lives. Cardiovascular disease is America's biggest killer, causing approximately 610,000 deaths a year. It's estimated that statin use has prevented thousands of heart attacks, strokes, or deaths from cardiovascular disease. These drugs primarily benefit those who have suffered a heart attack or stroke, or have angina or peripheral arterial disease. Statins have been tried and tested for 20 years. They've been in use for over a decade, and most trials involving tens of thousands of patients continued for 5 years or more. Researchers have investigated the potential health benefits of taking statins. There is evidence that statins may reduce the risk of heart attack and death in people with heart disease, regardless of cholesterol levels. Cardiovascular events and death in people who are at high danger of developing cardiovascular disease. Heart attack, stroke, and death in individuals with elevated levels of C-reactive protein, a sign of inflammation in the body. Cardiovascular events in women who have cardiovascular disease. Surgery to improve blood flow to the heart and unstable angina in women. Statins may also help lower blood pressure. Larger doses of statin drugs are associated with greater likelihood of side effects, and additional risk factors such as other drugs, older age, diabetes, and high triglycerides also increase the chances of adverse effects. If your doctor prescribes statins, some common side effects that you may have include nausea or diarrhea, insomnia, fatigue, headache, pruritus or itchy skin, anxiety, constipation.